So this week we have a special episode. Coming in from Ohio is Joe and his wife, and is it Shana or?
Shana.
Shana. Coming in from Ohio to talk about how he's been dealing with his Crohn's by treating his spine.
Yep.
So thank you for being here. Joe, you look nervous right off the bat.
Yeah.
It just, you know what? Why don't you start us with, when did you first have symptoms? How long ago was it?
I was like 21 when I started seeing a lot of issues, and then I got 2001. Everything's really started to progress. A lot of bathroom breaks. On my job, was questioned a lot. Why are you going to the bathroom so much? And
so you were 21. You were 21.
Yeah, about 21, 22.
What were some of your first symptoms?
Constant going to the bathroom, stomach aches, pain. I kind of didn't know, if I was going to get in trouble with my job,
Were you guys together then?
No.
And what'd you do for it?
Just constant went to the bathroom, thought something was wrong, thought it was the food I ate, thought it may have been just stress in general, thought it didn't get enough sleep, whatever it may be. The normal excuses.
And obviously, yeah, and you know what? And everybody does that, right? It's not like you have a loose bowel movement one day and then you go to the doctor the next. It's normally, it has to be over time, and you see it's not changing even though you're trying to change your diet, your sleep habits, your eating habits,
Correct.
Stuff like that. So it's not changing. It's probably getting worse, I'm assuming.
Yep.
You ended up going to the doctor.
Yeah, I went to at first, I went to the doctor. They gave me Azicol. Tremendous amount of pills a day. It was almost, I don't know, I couldn't even, it was like 8 pills 3 times a day. Normal person working or functioning throughout that day was never gonna basically take those pills.
Did they help?
I think maybe at first, but because they may have slowed down like the actual bathroom breaks, but as a whole, I don't think so.
Well, and so they're trying to treat you. They're trying to help your symptoms. Did they have a reason for the symptoms? Did they have a diagnosis?
They said at the time it was either colitis or it was Crohn's. At that time, obviously, it was an early stage of Crohn's in that era, is what I was told. Saw a doctor. He basically just prescribed this, said, oh, this will be great. You'll take these pills. You'll go on with life, and things will get better for you.
Was this a primary or a GI?
This was an actual GI.
Okay.
Yeah. So I talked to the primary first. They referred me to a specialist, which was the GI at that time. And then, just took the pills. Like I said, couldn't hardly take them half the time, so it's probably my fault too, but the amount of pills you had to take in a day was just insane for me.
So once the pills stopped working, or once it was obvious it wasn't the solution, what'd you do then?
That continued, and then until I had 2 hospitalizations. One, I had 3 inches of small intestine taken out because I had a blockage. So that's what led up to the Azicol. The Azicol wasn't working, so it caused a blockage. Like I would basically eat, and then I would basically throw up my food a couple hours later. And I didn't know why that was happening. I thought maybe I was just getting food poisoning. Like typically you sit down and eat a big dinner and you're like, why am I throwing this up?
Huh.
So that progressed, and then left the hospital after I had the 3 inches of small intestine taken out.
And how long ago was that? That was
in 2010, 12.
Okay. Somewhere around there. Somewhere around 13, 14 years ago.
And then about a week later, I ended up back in the hospital with another blockage. And then they took 3 feet of my small and large, and then they had to basically...
So you had 2 colon surgeries?
Yeah, 2 colon surgeries.
Okay.
So they had to piece it back, sew it back together. I guess that's what the terminology is. So they said that I would basically go through life and figure it out.
Well, that's when they put him on Humira after the second surgery.
And up until that, it was the pills.
Yeah, Azicol.
Okay.
Yeah.
So put you on Humira.
Yep.
And at this point, did they diagnose you with Crohn's?
They diagnosed him during the surgery.
Okay.
Yeah, when he was under, that's when they determined
And
that
I'm
it was
assuming,
Crohn's.
so, and again, for people at home, there is no diagnosis for Crohn's. There's symptoms, the inflammation, and there's things that increase the likelihood, like biomarkers and stuff like that, hereditary factors. But there's no test that you can take that confirms Crohn's. It's just signs and symptoms.
Right.
And I'm assuming it was the inflammation that they found during that they diagnosed you with Crohn's, which is a little difficult because ulcerative colitis presents like that. Generalized IBS or colitis presents like that. So it's a little difficult to see which bucket you fit into.
Right.
But they diagnosed you with Crohn's,
Yep.
gave you Humira.
Yep.
How did that help?
At first, it worked great. Everything was leading up to it. Takes us into 2023. I started having more issues.
So this is a while later then. This
yeah,
is 11,
yeah.
12 years later. So
Yeah.
11, 12 years, you're doing good?
Great.
What's good mean?
Good. A lot less bowel movements. Taking EpiPen, every 2 weeks.
The Humira pen.
Yeah, the Humira pen.
How many bowel movements do you have in a day over that time?
As the years progressed, I was probably down to maybe 6 or 7.
Okay.
But then as I progressed, the years, it started not functioning as well, and then we're back into the 20, 25 times a day. And it could be throughout my day. It wouldn't just be in the morning or evening. It would be throughout my entire day. So
It literally got to the point where he wouldn't eat throughout the day just because he didn't want to go to the bathroom.
yeah.
So he would go all day without eating much at all.
People don't realize how much this GI affects your life unless you have it, right?
Yeah,
or
correct,
you're with
correct,
somebody that has
correct,
it, right?
correct.
You don't want to go out, you don't want to eat, you're tired, you're upset,
Right. Yeah.
Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference. So it's working less, the Humira. Did they
Correct.
change your did they up it? Did they?
No.
They wanted to,
Yeah.
but we were hesitant because we did know it worked, at least a little bit. And they always say once you go off it, you can't go back on it.
Okay.
Your body rejects it.
Because it's regulating the immune system. So we kind of pushed back on them changing it. But
So so this is in 2022, 2023.
Yeah.
What'd you do for it then?
Just stayed doing the same thing.
Okay.
As every 2 weeks, every 14 days.
And you have your own business, you guys have children.
Yep.
There's not a lot of time to do a bunch of different treatments and stuff like that. You don't necessarily, people don't realize, I have my own business, like the stress and constant headache that you're under, you don't have enough bandwidth for this other stuff, including your own
Correct.
health. And that's the same thing with having kids too. It's your health takes a back seat.
Right.
So you're just dealing with it.
Yep. Day-to-day stuff.
And have you, over the course of the years, I'm assuming you've also tried different diets.
Correct.
And different, like maybe supplements and stuff like that. Any that pop off in your mind?
Yeah, we like I said, I would just supplement my meals. Basically whatever you eat is going to come out, right? So the less you eat, the less you're going to have to go. That was my mentality. I don't think that really worked that well for me as well down that path. Then we tried more of the liquid diets and get off the meats and move more toward protein powders. That didn't really work either. So I've changed up diets. I've done basically everything I possibly could do on my end without being a doctor, out not knowing much more. And then, so we're here.
Well, and then how did we cross paths? You guys live in Ohio, I'm in Pennsylvania.
Right.
How did you find me?
So, yeah, so I watch TikTok a lot, but I'm just a firm believer that God puts people in your path when they're needed, right? So you popped up on my For You page on TikTok, and I thought, you know what, this is a sign, because he was really struggling at that time. We were up to like 25, 26 bowel movements a day, and I'm like, okay, this is on my For You page for a reason. And I believe God put that there. So I told him we need to make an appointment.
And a question that I typically ask, what made you trust this information? Because A, it's a stranger on social media. And then B, it's different information than pretty much anybody else gives you. I'm some random guy saying, hey, a spine issue can cause GI problems and it doesn't get looked at. What made you believe that?
Yeah, so I'm a pharmaceutical analytical chemist, so I'm very data based, right? So your video that you made where you talked about there's no way to test for Crohn's, right? That really triggered in my brain. And I thought, you know what, he's right. Like, there's no data to back this up. There's no data for his diagnosis. And that was when I was like, okay, there's something to this. And I watched your other videos with the testimonials, and I thought, you know what, these people's lives have been changed from this. There's something behind this. Let's try it.
And we didn't do a consult first, right?
No.
I think
We
because
just came here.
well, it was funny. Your first visit was in person,
Yep.
and we followed up over telehealth since then.
Right.
But I remember on the first visit, we didn't even. I thought you were the patient because we had your name.
All the information.
So
Yeah.
on that day, we realized it's Joe, and Joe, like, it was very clear that you were drug here.
Yeah.
It was very clear that your
Yeah.
wife made the appointment.
I'm
Yeah.
very, very skeptical, like,
Yeah.
not that what you do is not that. It's just, like, I've just done the pills, and I've done the doctors, and I've listened to them all, and, like, that's what we're trained to do since we're a little kid. Go to the doctor, they'll fix you. But obviously that wasn't the case, and I wasn't being fixed. So, the wife stepped out there, and she said, we're going to book a trip to Pennsylvania, we're going to do this, and you're going to come. And I'm like, okay.
You turn it into a trip. You turn it into a trip. But again, like, first visit, I was like, man, this guy does not want to be here. He's like, which maybe is even better. It kind of speaks to you, because you should be skeptical, right? You should be skeptical if you're hearing different information. I don't want anybody out there to just believe what is said. You should make it make sense. You have a medical background. Like, you can distill that a little bit better. But, like, you should go into it skeptical.
Right. Correct.
So you're skeptical. The first visit, I'm evaluating you. We're asking about your symptoms. But then we're looking at your spine. I pressed on your spine, and you have had a history of back pain, but you haven't had back pain in a long time, right?
Correct.
But we found back pain.
Yeah, we did.
we
Yes,
found
we
back
did.
pain when we pressed on you, and I think. Don't let me speak for you, but I think that was a moment that you started to think, oh, there might be something, because it was pretty painful for you.
Yeah, correct. Yeah, when you pushed on my back, I about came off the table, and I thought, okay, we're on to something. And then after the visit, leaving here, you gave me the stretches, went home, worked on them, due diligent, because I wanted to find another path. Like, I was, like I said, skeptical at the beginning, but then I started to believe, and now, 3 months into this, and still a believer.
How long did it take until you saw a change?
I would say in the first week,
Well,
dramatic
first week or
change,
so,
and then 2 weeks was a lead up to even more of a dramatic change, and then by 3 weeks, life change.
What was that change for you? What were you seeing?
Way less bowel movements, knocked down a lot of percentages as far as pain, back pain, plantar fasciitis, hip movements. Like I said, I do landscaping, so I do a very physical job. We deal with pain, I guess, because we don't really, as a man, you're supposed to be strong and brutal, and you can do all this, but when you come home and your aches and pains and everything outweigh what you do, and then you question why you're doing all this.
Well, and you mentioned plantar fasciitis. To kind of speak to that, I've talked about how a lot of the people that have a spine issue that's causing their GI, they also have some other symptoms that are relatively common throughout the groups. And one of them being like hip and groin pain, but specifically pain down the leg. And a lot of them, for whatever reason, I don't know why, but a lot of them have been diagnosed at some point with plantar fasciitis.
Yep.
And during the first visit, you had talked about that you had that.
Yep.
You've had it for years.
Yep.
You had inserts. You've had treatment.
Correct.
I think you've done physical therapy for it.
Yep.
And it didn't change. And after the first week, that went away.
Correct. Yeah, I've done the foot doctor, gone doing stretches. I've done cortisone shots. I've done all that. And like they gave me these, fitted inserts, like you custom fit them to your feet, and
Which are $500.
Oh, they were
yeah, exactly, for
expensive.
sure.
Yeah, didn't
for
do
sure.
anything.
Bought several pairs of boots, thinking it's a boot brand. It's this and $300-400 every time you're buying a pair of boots. Thinking you're buying the next brand up. And nothing worked.
No, and that was really cool to see. And we use those orthopedic signs to make sure we're going on the right track. Because sometimes these GI symptoms don't change as quickly. And that's something we were just kind of talking about. So the fact that in week 1, your foot pain went away.
Correct.
Like, okay, we're on the right track.
Right.
Hey, just a quick break here and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult within 30 minutes. I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show. You saw some changes in him during this time as well. I forget what it specifically was, but on one of the visits he was like, yeah, Shana saw a difference.
So the difference I saw was he wasn't as bloated. His stomach wasn't as extended as it typically was with the Crohn's. You could always tell when he was in a flare-up because he would have this extension, and it was just, you could tell there was a lot of inflammation going on in there just from looking at him. We haven't seen that recently, which is a blessing. So obviously we know that the stretchers are working and that this is making a huge difference in the amount of inflammation. Just from looking at him, you can tell.
And it's great. It's like what and you both know, the changes that happen because of this really affect your lifestyle, right? I think. Correct. Can you speak to that a little bit? Like what are you doing differently in your life now versus before when you were having more of your symptoms?
Yeah, like not just doing the Humira, not doing stretches. It was just day to day, constant, like whether I talk to a client, get nervous, whatever, and then have bathroom breaks several times, pulling in gas stations, local places, whatever. Now, we travel, we go different places with doing the stretches, go into hotel rooms. We have a bag with all of our, equipment stuff in it, doing the stretches. And then doing them consistently, like obviously that's the name of the game is,
How long does it take you each day to do all the stuff that you do?
If I take my time doing it, maybe half an hour.
Okay.
If I speed it up, maybe 20. I mean, it's not, I can definitely fit it into my routine, and I work a ton, like I say a ton, but 12 to 14 hours a day, so.
And it's not a for everything for the people at home watching, but it is. For a while, a few months, it's a day-to-day thing. Right. It's a day-to-day. It's a few times a day. Like you have to get to the point where, think about it. Like we're treating your GI by treating your spine. If your spine's that bad, that's affecting your GI, your legs, your hips. Then it needs to move. We need to remodel tissue. We need to take some pressure and keep pressure off of the nerve and nervous system. So it does take a little bit of time and energy. How difficult was it for you to get into this routine and?
Immediate. I was tired of living in pain. My wife even noticed it immediately. I was just tired of just constant pain every day. Like no matter if I rolled out of bed, I put my feet on the ground, my feet would just hurt. If I was doing day-to-day operations, like I was just tired, I was fatigued, I just wanted to change, and I knew medicine wasn't working, and I didn't necessarily want that quick fix, but I did at the same time, and it was just me getting up, doing my stuff, the exercises.
Yeah, and I'm glad that it was that quick, because it's not always that quick, but seeing a decent improvement in a week, that helps keep you engaged, right? That helps you believe it a little bit. At this point where you're at now we're 3 months in. What's your take on your system? What's your take on your outcome here?
I'm a believer. I think the outcome later is hopefully to get off of the prescription drugs. That is my long-term goal, you know, because medicine does help, don't get me wrong, in certain areas, but I'm looking for that change. I don't want to always be tied down to a prescription drug.
And what percentage would you say you're at now? We ask this question a lot. You know, 0% is when we started, 100% means I am perfectly healthy. That's exactly where I wanted to get back to. That's what you wanted. Where are you at?
I would say easily 85 to 90, maybe 91% in this 3 months, just because, you know, I've really tried to strive to really do this.
And did you change anything else during it? Could it be a coincidence?
Yeah.
Could it be a coincidence? Or could you just be in remission? Could you have changed your diet or your mattress? Is your relationship better over the last 3 months? You know, is that what's causing this?
No, I mean, my wife's my best friend, so we do everything together. But no, nothing's changed in my life, my day-to-day operations, my day-to-day clientele base. Nothing I've done on my end actually. Before everything, I thought it was different foods that I would eat that would irritate my stomach.
But he's actually started eating more of these foods, and he's
more
still
the
okay.
bad foods.
More of the bad foods.
Labeled bad foods.
Yeah.
So yeah.
We really tried hard to keep all of the variables constant when we started this process, because we wanted to see if this was what was going to change things,
Sure.
right?
Yeah.
So as a data person, I wanted all the variables to stay the same. I didn't want us moving around different things. I wanted to see where this would take us. And so, yeah.
It's something I preach, right? And for me too, it's not even just knowing whether or not this is effective or not. It helps me, because there's always some troubleshooting along the way. You know, it helps me if you're sore here, or you're better here, or you're not better here. That tells me what to do next. But if you decided to take up marathon training for the first time, or you changed your mattress, or now you're eating gluten-free, whatever. If you've done any type of change, maybe it was that, you know, so you don't have that. So it's nice to sit here and say, hey, really the only difference was moving my spine a certain way.
Yeah.
Now, going back over the course of these last 20 some years,
right.
Was there ever a moment that you thought that it could have been a back issue? Did any doctor, anybody along the way say, hey, maybe it's your spine?
No, not a single one.
How many doctors do you think you consulted?
Well,
we've had
three so far.
gastroenterologists.
Yeah. So, and not one time. It's always been, well, you have a blockage, you may have another one. You may see different variations in your stool due to the fact that you've had these operations, but no quick fixes, no long-term goals, no plans in place. It's just take these prescription drugs and hope these work. And when another one comes on the market, hey, let's talk about that one.
And I understand the treatment, and I'm not against medication per se. I'm against the way we use it, but I'm not against medication. But a blockage isn't a diagnosis.
Right.
A blockage is a symptom.
Right.
Inflammation isn't a diagnosis. Inflammation is a symptom. So and a lot of the treatments that we do, we're trying to treat the symptom of a blockage. Yeah. We're trying to treat the symptom of inflammation. And for me, and that's the way a lot of the medical system operates right now, but which is fine temporarily. You know, we need to provide relief to the patient. You're in pain, you're discomfort, whatever. Right. But it seems like that becomes the sole focus, and we stop looking for the underlying cause.
Right.
And now all of a sudden their symptoms change, progress over time, and now because you didn't look for the underlying cause, you just keep going down that rabbit hole of, now we're treating this, now we're treating this.
Yeah.
And it's frustrating.
Yeah. Well, along with the blockage, my last blockage was so bad, we were actually in the hospital for 10 days. So I was bedridden, I had to relearn to walk again. I was really bad off, and it scared the doctor, actually.
He was very anemic. They said that, honestly, he should have been dead due to the anemia.
Wow.
Yeah, when they ran my vitals, they said, we don't even know how you're here. So I was immediately pushed right into surgery. When I showed up there, I physically drove myself to the hospital. And then they ran my vitals, and it was a scary moment for me, and I'm kind of standing there what's going on? And next thing I know, I'm being rushed into emergency surgery. Learn to have, like I said, we had to learn to walk again, had to learn to eat again. So, yeah.
And that was about 13 years ago, something like that, 2011, 2012, yeah. Have you had any blockages since?
Nope.
Okay.
No.
Yeah, I mean, and it's nice to hear you were just here at the tail end of another interview with a 15-year-old patient, that only had his symptoms for a few years. But for you, you've had these symptoms 20 plus years.
Correct.
And you've had surgeries.
Yep.
You know, and you've been on biologics and medications and stuff like that. So this has been a long road for you.
Right, correct.
Now where you're at currently, what's your, and I know we kind of talked about this a little bit, but like, are you still skeptical about the spine? Are you afraid that it's going to go back at all, or?
No, my main goal now is to proceed forward, 100%. Like, do the stretches, do the exercises, find that this is like the alternative, and eventually, decide to go off of Humira itself. That is our long-term goal. I mean, so.
Yeah. I mean, I think we know if he ever starts to regress, the stretches are there, right? So like we can start him up again if we needed to, or.
And that's the cool part about this is kind of empowering you guys to, hey, because people will fall off, vacations happen and holidays and stuff like that, you'll fall off for a short period of time and hopefully you don't get symptoms back. But if you do, all you have to do is just be a little bit more routine with your exercises for a little bit of time and get back on track.
Right. Yeah.
Any difficulties along the way? How, like a lot of times when we first start this, so I'm telling you to bend forward with weight, something that pretty much everybody. So the main exercise for the people at home is I call it a modified Jefferson curl. That's maybe that's the main one, right? There's other ones, and I think you have a total of 5, 6 exercises, something like that. So the main exercise is bending forward with weight, which is what everybody tells you not to do.
Yeah.
It can make your back pretty sore. Did you have any moments where you're like, I don't know if I can stick through this?
About 2 weeks. I was like, I was still excited to do them, but then like my work schedule got in the way, and then I'm like, well, maybe. And then I would just be like, no, I got to do them. And then I would go back to them, and then it came to the realization of the wife, and she's just like, I'm so proud of you. You're actually sticking with this, because it doesn't make sense in the beginning because you're, like I said, you're so prone to just take an injection and go on with life, and then you're just like, oh, you're gonna do these exercises, and that's gonna make you feel better and be healed. But now knowing doing them and the life change that I've had and seen is now, benefited everything, so.
And we started with a 20-pound weight, right?
Correct.
And I think you just recently ordered a 60-pound weight.
Correct.
So, which is, I mean, that's a lot. It's a big jump in 3 months. Have you had any back soreness?
No. That's the crazy thing. I haven't. Yeah, like no sore, no pain. And I actually feel better when I do them. I know if that makes sense, but.
Well, it should, right?
Yeah. Like if I don't do them, I'm in pain. But if I do them and I stretch them and I feel great. Like it's actually like a morning routine, like a workout,
Yeah, and I think it's great. And again, like 30 minutes a day, I'd like to eventually cut that back to you for like maybe 15 minutes, which is in the plans. Yeah. But for right now, 30 minutes a day, that's not bad.
Yeah.
Real quick, if you don't mind, because people at home are sitting here going, all right, well, like what was he experiencing? Like, where's he at now? I'd like to just run through the symptoms you told me on the first visit, and then you kind of tell me where you're at, if you don't mind.
Yeah.
So first visit, you know what one weird one was that I don't think anybody else has told me? That when you were on the toilet, a lot of times your back would pop.
Yeah.
That was something you told me first visit.
Yeah. I would have bowel movements, and like literally on basically the push, that's when my back would pop. Like basically in the middle of your back, like my back would literally pop.
Which is the spot, by the way, that's at the TL junction area, which innervates the intestines. So. Right. But nobody else has said that back popping one, but that's gone away, correct?
Yeah, correct.
So that's one. Yep. So it was in the morning, bowel movements from 6 to 9:30. You said like 15 of them.
Yep, at least.
Where are you at now?
Maybe like 1 or 2.
Sometimes none.
Yeah,
I mean,
sometimes none. Sometimes I just wake up out of bed and
and
I won't have a bowel until.
And not to overshare, but another one was the urgency. And you made me laugh on one visit. You're like, I'm not running to the bathroom with my cheeks clamped together, something like that.
Yeah.
My butt cheeks clamped together.
Tendency I would have problems like, you think at first it's gas, and they always say don't trust a fart. Okay, but in my case, I never trusted one. Like I was always worried that my bowels would just lose the muscle capacity, and I would just basically poop myself, and then I'd stand there in awe, like, what am I going to do now, or I'd be in a meeting and, they always say Crohn's patients know where like the closest restroom is at all times. So like immediately we go in a building, I'd have to know where the bathroom is immediately just in case I had to go. So the urgency, within the morning would basically wake up out of bed, I'd stand straight up, clench, run to the bathroom. And that was a consistent thing from
What I'm sure a large part of that too in your mind would have been like, hey, I had 2 surgeries on my bowel. This just might be my new normal.
Correct.
So it's cool to see that change.
Right.
And so now I don't think you told me yet. We haven't caught up in it for a few weeks that you're not having sometimes any in the morning.
Correct.
Yeah.
So that's great.
More a recent development.
Yeah. Yeah, that's really good. You talked about the plantar fasciitis. That was something that came up on the first visit. And I think on the first visit I said that's going to change.
Right.
And I think I got a skeptical look from that on the.
That was the very first thing to change. So that was like immediate.
The orthopedic symptoms, those are the ones that I expect to change the quickest. The GI symptoms, they tend to take a little bit longer of a time, but again, like within 2 to 3 weeks, you should be seeing some change. So the fact that you had that beforehand is great. Right. Driving, you would say if you were to sit for 2 to 3 hours, your hips would hurt, and that's a common one.
Yeah.
That is a very common one. Sitting for a long period of time, people will get hip pain or stiffness.
Yeah.
Difficulty, like then when they do go to stand up, they feel stiff, sore.
Yeah.
How's that been?
It's been great. And it's not just driving wise too. It'd be like me sitting in a seminar or me sitting in a lecture or anything like it could be church, for instance. Just anything that would be a long extended period of time, like my hips would just literally hurt. And I just thought, well, maybe I'm just getting old. Maybe, maybe you just got to turn, twist, do whatever. But no, I don't have any of those pains now.
Is there, and that was the majority of them from the first visit. It was back pain, leg pain, hip pain, and then it was all of your GI symptoms.
Correct.
Is there anything else that you guys can think of that's been changing? Food tolerance, and I think you kind of said that now you're eating quote unquote worse.
Yeah. Well, yeah, because there's no particular diet. There's no particular thing. You basically, at least that's what I was told with my doctor, is that you'll eat food, and if you can't tolerate it, just don't eat it. So there's really no particular diet that I was ever told that when you're with Crohn's, that would play a part. And basically, so people just live with whatever they want to do, and then until it hurts them or until they have the problems with it, and they just cut it out.
Right. For instance, onions. He was never able to eat onions for years, and more recently, he's reintroduced onions back into his diet, and he's been fine.
Yeah.
Like he hasn't been having the same symptoms that he had years ago whenever he would eat them, or even salads too, right? Like
roughage,
the
carrots,
GI doc
vegetables.
always said, don't eat roughage, don't eat salads, carrot, like raw vegetables, stuff like that. And that did used to affect him. Like he used to have problems with those, but recently he's been eating a lot of salads and carrots and stuff like that, and he's been fine.
Yeah. Which is great.
Yeah.
It's great to see that. Have you had any, do you have any follow-ups for the doctor coming up? Have you had any blood tests recently?
Yeah, so I did have those, I guess it was back in February.
It was right before we saw you though, so we haven't had any since then.
Yeah.
He gets the blood drawn once a year, and he has a colonoscopy once a year.
Okay.
So before we saw you, though, the colonoscopy results were not great. He did have a lot of inflammation, and the biomarkers and the blood work did show that as well. So I'm thinking we may reschedule an appointment just to have the blood draw redone again and just see where we're at.
Yeah, I'm very curious to see the difference.
I want to see the data difference. So.
And I think that's the other part. I think that's maybe another part of this that a lot of people want to see, and it helps reassure them, because even though you're feeling good, even though you've seen the change, like what you said, I still want some data. I still want some black and white. I still want to see the inflammation come down. I want to see that they're not finding as much inflammation during the colonoscopies and stuff like that. I want to see some of your blood tests, improve your iron levels, whatever was off before. I want to see that improve too, and I think you will. Most my other patients, they've seen that change, but it's really nice to have that data there.
Yeah, for sure. Yeah.
So now you're 3 months out. You're 85-90% better. Have you admitted to anybody that, hey, I've been treating my GI by going to this doctor
Yep.
I found on
Yeah.
TikTok.
Yeah.
You know, what's the response been?
I push the envelope all the time. I'm a big supporter of you, Dr. Caleb. I mean, you've life changed me. I've told my parents, I've told anyone close to me. They look at me and they're like, what are you doing different? Like, are you changing your diet? Are you done this and that? I'm like, no, I go see this guy.
So other people have seen a change
Yeah,
in you, like outside the family.
Yeah.
What did they say?
They just say, keep doing what you're doing. Like, we don't know what you're doing, but keep doing what you're doing. And after I tell them, you know, and I tell my mom, you know, like different exercises that I'm doing, that, you know, she was diagnosed with colitis, and she's had all kinds of issues, and I tell her all the time, and she's probably going to be a future patient. But yeah, so I don't know, I can't thank you enough, man.
I'm really glad, and I don't know if you were on the tail end of my other interview, but you know, I get a lot of pushback from this. I probably shouldn't share this, but I actually had somebody report me to the board for treating outside my scope, and it went away. It wasn't. But I get a good amount of people, like, you know, the internet,
Correct.
and they're saying pretty horrible things. They're saying I'm not right. I'm outside my medical world or my expertise. And again, I'm talking about the spine,
Right.
so well within my expertise. But I get a lot of pushback on this, and there's some days where you're like, maybe I just, you know, maybe I stop fighting this. Maybe I stop pushing this forward. But when you have people like you that come here and
100%.
It's helpful.
Yeah,
This is probably more for me than for, you know.
I feel like if you're doing anything good, you're going to find hate.
Yeah,
There's always going to be there.
Absolutely.
Yeah.
But there's a reason, like I said, that we came across your post on TikTok, and it's really made a life change for Joe, and we're very thankful for that. So
I'm really glad to see. It's terrific. And it's not everybody. It's, you know, there's people out there that have GI symptoms that aren't from their spine. But the whole point of this is that there are a lot of people that have GI symptoms from the spine,
Right.
and it doesn't get looked at. So all this has to be is an earlier part of the differential diagnosis. You say you have these symptoms.
Yep.
Hey, any history of back pain? Because you did have
Yeah.
a history
Yeah.
of back pain.
Oh, absolutely.
Even just that question,
Yeah.
even just that little question, that might be enough
Yeah.
to change this path a little bit.
Right.
But, so hopefully one day.
Yep.
Hopefully one day.
Yep.
And thank you guys for being here. Like, this is difficult to share. Obviously, it's personal information,
Yeah.
right? You had to drive 9 hours to get
Yeah.
here. So
And I would do it again for you.
yeah,
I
this
would
is
do
the
it
second
again.
time we've driven here, but it's been great. So.
no, I appreciate it. And hopefully, just like you came across some other people's videos, there's going to be people out there that come across your video and
Yep.
say, hey, everything that he said, that was basically me. I've tried all this. That sounds like me. Why not give this a try?
Yeah, if anyone out there is questioning this, please don't think about it much more. I'm here, okay? Like, I wasn't supposed to be here.
He was drug here.
Yeah.
he
I
was.
drug him here. Yeah.
I would be the last person to call
Yeah.
up a chiropractor to do this.
Yeah, physical
but,
therapist.
I mean, I would definitely recommend coming to see Dr. Slater or setting up an appointment, setting a telehealth, whatever. I mean, you'll see some change, and that if that little change is just something to benefit your life in a small aspect, it's totally worth it.
Yeah, thank you guys.
Yeah.
Appreciate it.